Hi, in this video I'll be talking about different types of surgery for thyroid. The type of surgery for thyroid gland depends on the extent of the thyroid that is removed. That is, whether we remove the full thyroid gland or part of it. Now, when we remove the entire gland, it is called total thyroidectomy. When we remove a portion of it, generally we call it hemithyroidectomy. Hemi means half. So, surgically, when we remove more than a half of the thyroid gland. That is, there is a one lobe plus there is some portion called isthmus. Isthmus is the connecting area of the thyroid gland. So we remove the lobe plus isthmus. That is when it is called hemithyroidectomy. Now the type of surgery that we choose entirely depends on what is the disease that we are treating. Generally, if we are treating a thyroid cancer, the preferred surgery is total thyroidectomy because it makes it much easier for us to follow up the patient. It makes it much easier for us to treat and complete the treatment for the patient. So generally we prefer a total thyroidectomy for cancer. When it is a benign disease or a very small thyroid cancer, like below the size of 1 centimeter and all that, so those scenarios we offer hemithyroidectomy. So the gland, the disease bearing gland is only removed in those situations. So these are predominantly the two types of thyroid surgeries. There is one more entity called subtotal thyroidectomy and there is another entity called near total thyroidectomy. Both these surgeries are not performed in today's era. It used to be done before, but there are a lot of problems associated with it. When we say subtotal thyroidectomy, we leave behind a small portion of gland on the side of the disease, or when we are performing a total thyroidectomy, a small portion is left behind. So what happens is, tomorrow if you develop some problem with that particular area, the re-exploration or re-surgery becomes very complicated. So generally in today's era, there are only two types of surgeries that you need to remember. One is hemithyroidectomy, where little more than half of the gland is removed, and the other one called total thyroidectomy, where the entire gland is removed. In the next video, we'll be discussing about various approaches to thyroid surgery. Now, approaches means, whether we are going to do it open, endoscopic or robotic. So that's a completely different topic. So wait for the video. Thank you.